Our fellowship program is a tremendous opportunity to see bread and butter pediatric ophthalmology as well as high-level complex cases. We have one of the largest departments in the country, and so our fellows have an opportunity to work with some of our masters in our field and also to gain understanding of subspecialty practices within pediatric ophthalmology.
The breadth of the experience in pediatric ophthalmology is unmatched. There are so many different subspecialties now in pediatric ophthalmology, and we have experts in all of those fields who love to teach and are here because they want to work with trainees, and they want to work with fellows, and they want to create the next generation of leaders in our field.
This is an exciting time to be part of Boston Children's Ophthalmology because there are so many new approaches to imaging, to patient care, and in basic research and in treatment that are coming out, and we're in the middle of all that.
Our fellowship really prides itself on the diversity of experience during the fellowship year.
We have experts in trauma and cataract surgery and glaucoma surgery. We have pediatric retinal specialists, both medical and surgical. We have an inherited retinal disease specialist. We have 3 pediatric neuro-ophthalmologists, and we all share and treat all of these patients who have complex medical problems that require multidisciplinary care at a true quaternary children's hospital.
I think what we have to offer is mentorship with some of the most renowned pediatric ophthalmologists in our community, and that mentorship goes well beyond the year of fellowship training.
We also have a very intensive adult strabismus program. And one of the things about adult strabismus is that it's an especially hard aspect of ophthalmology to learn on your own if you're not part of a training program that has robust experience in complex strabismus.
We also have incredible surgical numbers, and those numbers not only are in strabismus, both pediatric and adult, but also in anterior segment and ROP lasers. And so I feel that in 1 year, we're able to really cover the breadth of pediatric ophthalmology, both from a clinical and surgical point of view.
In addition to the surgical experience where you get to operate on pretty much every part of the eye, you also get experiences in seeing inpatient consults and seeing patients with diagnoses that you've never heard of to diagnoses that are much more common. And so you kind of get that whole experience to make you a well-rounded pediatric ophthalmologist that I don't think you get many other places.
Boston Children's is a large referral center from all over New England, all over the world, really. And so you get to see and experience a wide range of conditions of pathology. And as a fellow, you're right there. You get very engaged in all aspects.
We have the largest pediatric ophthalmology department in the country. That's amazing because you're getting this great relationship with so many different people.
It's unique, it's special because you realize how everyone has a slightly different approach. You almost take little bits and pieces of each different faculty member, and you really incorporate that into your practice, and by the end of the year you see that combination of all the various pieces that you've put together through the fellowship year, and I think that's special, and that really builds well-rounded and excellent clinicians.
If you have an interest in glaucoma, you can spend some more time with our pediatric glaucoma specialist. If you have an interest in plastics, you can work with our oculoplastic specialist. And so to really delve into those specific interests allows you to shape not only getting the comprehensive ophthalmology experience, but having the opportunity to really focus in on those areas if you so choose.
There are a lot of opportunities to do incredible research within the department. You'll see it's a broad research program that we have here, extending from basic science to translational research into clinical research projects.
At Boston Children's Hospital, we want everyone to love their job, and we have a mission of delivering great patient care, of new discovery, of finding new treatments, but then importantly of disseminating that knowledge that we learn around the world. As a result, there's this culture that suffuses the department of sharing knowledge and learning and discovery that we then translate back to each of our patient interactions.
One thing that's wonderful about the faculty here is that they are all dedicated teachers. And so there's this culture of learning and a culture of teaching. As faculty, you're expected to teach. And so that's wonderful because every clinic you're in, every OR you're in, people are expected to teach you, to hand over cases and for you to learn.
Our fellows are the heart and soul of our department. From the moment they get here, the fellows are a critical part of our team, and we rely on them for so much.
In terms of teamwork and the culture here, it's paramount. We love to have fun. We love to work really hard. We love to see all the patients and then at the end of the day go home. And that's the biggest message of the culture here, is that it's not only just about the work. It's about your family. It's about work-life balance. It's about making sure that the patients are taken care of and also making sure that you're taken care of.
One of the things I love about our fellowship is this growing family of fellows who graduated from Boston Children's Hospital. The spirit is created by our chair, Dr. Hunter, who really engages each of us in this idea that we are committed to one another, and that commitment extends well beyond the year that you spend at Boston Children's.
The relationships that you're building are relationships that will last a lifetime, and they really are foundational here. They become not only your teachers and your colleagues, but your friends and your mentors. And so I'd have to say the people here just really make the environment a phenomenal working and learning environment where everyone's dedicated to teaching, and I can't speak highly enough of them.
Whether you've been a medical student, a resident, or a fellow who's come through our program, you now become a part of our program for the rest of your career. So we often hear from fellows as they're embarking on their own career to get advice about patients, about how to run their clinic, about you name it. We form a bond during fellowship that lasts throughout a career.